Cardiac arrests claim 400,000 lives a year. That equals to more than 1,000 deaths a day. Emergency room staff at Ochsner Medical Center are using what is called a thermosuit in an effort to increase the survival rate of cardiac patients.
The thermosuit is a device which inflates around the body of the patient while the patient's lying on his or her back on a gurney, so that it looks sort of like an inflatable kiddie pool that hugs to the patient.
Ice water is literally pumped into the thermosuit. The plastic body wrap is designed to quickly lower the cardiac patient's body temperature to 33 degrees centigrade or 90 degrees Fahrenheit. Interventional cardiologist Dr. Paul McMullen says the thermosuit rapidly provides effective hypothermic therapy to the patient.
Hypothermia has been shown to improve a number of things in the animal research literature. So far, the only thing that hypothermia has been proven to help in human research is the brain and cardiac arrest. We believe that if one could lower the body temperature and lower the temperature of the heart tissue before that artery is reopened, then we could limit significantly the amount of damage that's done by the heart attack. That's never been proven, and we believe that one of the reasons that hasn't been proven is that no one up to now has been able to cool patients as rapidly and as effectively as we can with a thermosuit.
A Louisiana cardiologist had the idea to somehow dunk a cardiac patient into ice water in an attempt to minimize brain damage. That same cardiologist, along with an engineer, invented the thermosuit, and physicians at Ochsner are seeing amazing results. Last April, the thermosuit was used on New Orleans landscaper Steve Benton after Benton went into cardiac arrest while talking to one of his lawn care customers.
Within a minute, he said he had called 911. He started giving me mouth-to-mouth resuscitation until the ambulance came. The ambulance came and they took over from there.
Benton was initially taken to the closest hospital and was later transferred to Ochsner Medical Center.
We were frankly rather pessimistic about his chances given that prolonged period he had with a very poor heart rhythm and with a very poor blood pressure.
Dr. McMullen says they gave Benton a near 0% chance of surviving. But because Benton was immersed in the thermosuit and kept cool for 24 hours, Ochsner physicians were able to prevent permanent tissue damage. Remarkably, Benton beat the odds. His recovery from cardiac arrest has been quick and without any permanent neurological damage.
I'm back cutting grass. I've been cutting grass for 4 weeks now. And it's only been 10 since the heart attack. My friends, they all call me the Miracle Man.
Mr. Benton's recovery has been astonishing. The doctors and the nurses who cared for him in the hospital have been absolutely overwhelmed by his recovery. And it's been a tremendous stimulus to us to do our best to provide that kind of care for patients like him who come in with cardiac arrests.
Dr. McMullen says if Ochsner continues to show significant benefit in treating heart attack patients with the thermosuit, he could see other hospitals across the country using the device. And he says eventually the thermosuit could become the standard of care for cardiac arrest.
If we can prove that we can limit the size of heart attack by using hypothermic therapy, it could change the way we treat heart attacks, and that would make history.
I think it's great. I mean, I hope that they're able to use it on as many people as possible and have the same results that I had.